As reproductive psychiatrists, we're in a relatively niche field, so we wanted to talk to you today about our personal journeys and how we ended up here. I'm Dr. Nichelle Haynes.
I'm Dr. Kristen Lasseter.
And we're medical mamas. This is your place for evidence-based information about your reproductive mental health.
Meaning mental health in relation to reproductive hormone changes like around pregnancy, postpartum, menopause, premenstrual disorders, and infertility.
So today we're going to tell you how we ended up here. Okay, I'll let you go first. You go first.
Okay, I'll go first. So when I was going into medical school, I had actually worked for an OB-GYN the year before medical school as a medical assistant, and I didn't realize until that job like how much I enjoyed the obstetric and gynecology world in terms of just, helping other women, hearing their experiences, relating to things that they're going through, kind of seeing the, similarities between what a lot of women go through, but how they would feel pretty alone and things. And I found it really inspiring and felt really like meaningful work. So when I went into medical school, I thought, okay, I'm probably going to do OB-GYN or reproductive endocrinology or something in that field. And then I was doing and I actually told myself, I think I told one of my friends this too in the beginning, I will not do psychiatry. Like that's probably the last thing on the list. Like I kind of listed out the things.
Really?
Yeah. And I was like, psychiatry would not be something I'd be interested in. Of course, that's me being like uneducated at the time and not really having any idea what psychiatry really was. So I put psychiatry at the very end of my third year rotations in med school, thinking I'm not going to do it. Like I don't really need to prepare for, the interviews or anything like that. And then I did the rotation and I was like, oh my gosh, I love this. Like it's so fascinating. Like here you have people who really feel alone in what they're going through, but it's so, there's so many similarities in what they are going through, and they just don't understand that they're not alone and that this is a mental illness. This is a medical illness, something that their brain is having to struggle with, and doesn't matter like what country you're in or culture or religion or whatever, it's still going to show up in very similar ways across different people. So then when I was doing psychiatry residency interviews, I did a lot of interviews up in the Northeast because I am an overachiever and I overshot the goal of residency. So got to interview at a lot of like really great established residency programs. And in those places, I learned about reproductive psychiatry because in Texas, we really didn't have a lot of places that did reproductive psychiatry.
Still no.
Yeah, and in Central Texas, there was like no one who was known who did reproductive psychiatry, which is where I trained for med school. So fast forward, it was something I was like, this is perfect. It combines OB-GYN, which is a patient population I love, plus psychiatry, which is a subject I find fascinating, and just makes this perfect combination of something that I feel is really meaningful and special. So then I went to residency, did my psychiatry residency, did an away rotation because of course my psychiatry residency didn't have any kind of women's mental health training or education. So I had to go away, get training on that, and then decided when I got out in practice, there was really no established clinic for reproductive psychiatry. So I was like, okay, I'm gonna make one. We're gonna do this. And that's how it ended up for me.
Gosh, I feel like it just all came together exactly right.
Yeah.
Right? Like, here's this thing, and you learn this piece of information about what you like, and here's this thing about, you learn this piece of information about, like, the things that are interesting to you and kind of keep you passionate and excited, and it all just, like, kind of came together for you and just made it happen.
Yeah.
So cool.
It's a neat journey.
Yeah. Mine's less linear. I will say that I wanted to be a physician since I was 5. And it was like kind of always the path I was going down. And there's, as I look back, little pieces of things that kind of like make sense now that I've ended up here. In high school, we had to do this distinguished achievement program, and it was, I think it was, I'm just gonna guess, it was like a 20-page research paper in high school. It was like, oh my gosh, a sophomore in high school, or maybe junior.
It's intense.
Yeah, it was really intense. And so I did mine on prenatal diagnosis of birth defects and how that affects abortion rates and things like that. And so looking back, it's like, oh, okay, that like might be one of the things, you know. And then later on in high school, I took a psychology class, and I was like, this is it. Like, this is the thing. I freaking love this thing. And so in undergrad, I had a psychology degree, and I kind of had a little period of time where it was like, oh, I might want to go to grad school instead of med school. And the path had always been med school. And so I sort of had like my crisis period. I call it like, what am I doing with myself? What am I doing with my life? And so I ultimately decided to go to med school because it would offer me and my patients more opportunities. I could learn medication management and also therapy, because if you're going to go to grad school for therapy, you don't have the option to offer medications. And I did think that that was an important component. So I continued on the path to med school, knew that psychiatry was the field. It was never anything else, maybe pediatrics for a little bit. And then I decided I really just love playing with babies. I don't want to be their doctor. Like, I just love babies and like seeing the mother infant dyad, seeing them like kind of work together. And so psychiatry residency, of course, no perinatal training, no women's mental health. I think we literally had like one lecture on it, which I think is pretty standard. It's not a comment on my programming. It's just like kind of how it is or how it was.
Yeah, that's just common across psychiatry residencies in the United States.
Yeah. And I had a wonderful program, and I was really supported and happy in that program. And I just wanted to come back to Austin. So I found a inpatient psychiatrist role that I could take here, and kind of had a winding path through that. And then I was established at a hospital, and I realized there that I really enjoyed my perinatal patients. I was always like, give me those, like those are the ones I want, please. And so I started a unit that was specifically for women, and that has gone really well. It continues to be running here in town, and I really just got burned out on inpatient work. It's sort of is really draining, difficult work, and I couldn't do it anymore. And kind of in that path, I found Kristen, and she was looking for someone to join her practice, which was flourishing, and it kind of has all worked out for me to kind of do a lot of the things that I really enjoy doing, got additional training, and now I'm here at the practice talking about something that's really exciting to me.
Yeah, and something that we kind of talk about a lot is how much we enjoy the work that we do, and how there are so many patients of ours that are so special to us, and it's so nice to be a part of their journey and so meaningful. I feel really grateful for getting to do this work.
Mm-hmm. Yeah. Honestly, like if I'm complaining about work, it's not really about seeing patients. It's like, oh, I don't want to do my notes or like something else. I really do enjoy what I get to be with my patients. And honestly, I think a lot of it is like seeing a little bit of myself in them. I'm a mom too, and I see their struggles, and I, see pieces of what they're saying or what they're experiencing. I'm like, yeah, I'm so exhausted.
I know there's so many times where I have to hold back being like, I know, me too.
I don't hold back that much. I'm like, oh my God, I know.
Or,
so
well,
tired.
This, yeah.
I mean, we all can relate to like the fatigue at the infant stage. To be like, I know, like I have been there. I'm so sorry. I know how tired you are.
Or even just the relationship dynamics that come up around having a newborn or pregnancy, or the struggle to get pregnant, and just all the things. I just feel so grateful that we get to hear all these different stories, and it's an awesome career. Highly recommend it for anybody who's thinking about going into medical school or psychiatry too.
It really is very lovely. I'm very, very grateful to be part of someone's life, especially when I see them and they're at their lowest, and then I know them through all of that, and they find themselves again. That is so special to be a part of that for somebody. It's just awesome. So yeah, we recommend it. Do it. Thank you so much for being here. Please like, comment, subscribe. We'll see you soon.
Bye.